Hello and welcome back to OET Speaking Unlocked by Kirti Institute. In the last video, you saw how to open an interview confidently. We have seen four powerful ways to open any consultation. Now, in this video, I'm going to explain you how to ask questions. It is about information gathering, and we have created FAE Formula to make it super easy for you. So stay tuned with me till the end. So before I explain you FAE formula, I would like to show you what information gathering criterion saw in assessment criteria. So let's have a look. Indicators for information gathering, and this is a part of clinical communication criteria. And number one says that facilitating the patient's narrative with active listening techniques and minimize interruption. That means when the patient speaks, you need to be an active listener and an empathetic listener. You will show that you are seeing the patient, you are listening them, you are there to care for them. However, OET records your voice. So if you're just nodding head, it won't be recorded. So what you should do, okay, all right, I see. Okay, so that shows that yes, you are listening to your patient actively. And make sure that while you are doing so, you are not interrupting the patient while they are speaking. Okay, the next point says using initially open questions, appropriately moving to closed questions. And we are going to learn this in a specific way in FAE formula. Okay, so first of all, open question, gently move towards the closed questions. Not using compound questions or leading questions. Now, what does it mean? Compound question means asking more than one information at a time. Could you tell me where exactly the pain is and how severe it is? You are reducing your score. You may ask one question at a time. And the leading question is, I think you are in a severe pain, isn't it? No, you think that the patient is in severe pain and you are imposing your thought on the patient by asking a question, and that is not at all accepted by OET. Okay, so don't use any compound or leading questions, and I'll show you how you will get stuck while asking the questions, how you are tempted to ask leading questions or compound questions. Okay, the next point says clarifying statements which are vague or need amplification. What a wonderful criterion it is. Okay, this says that when the patient speaks and you don't understand, ask for clarification. For example, the patient said that I'm really confused or I'm really nervous about the misuse of using this asthma pump. Now you didn't understand what does it mean? What does the patient mean by misuse? Whether he says about overuse, underuse, no use, what it is exactly. Okay, so you may ask the question to the interlocutor, to the patient or carer, that what do you mean by misuse of asthma pump? Could you please elaborate it for me? Isn't it? It's amazing. If you don't understand, just ask for the clarification. And the last point says that summarizing information to encourage correction or invite further information. And I highly recommend to summarize the information at the end of information gathering, not at the end of whole interview. I repeat, summarize the information. Now, summary can be in a form of summary or it can be in a form of empathy. Okay, but somehow, whatever information you have gathered, you are just repeating or paraphrasing that information to just make sure that you have understood the information correctly. And if the patient has missed out any point, you are encouraging them to add that point. Okay, and don't worry if the patient corrects you. Okay, when you're paraphrasing the information, and if the patient corrects, don't worry. You may simply say that, okay, I have noted it down. Because why we are doing summary? To encourage correction and to invite further information. So don't you think so that OET has brilliantly designed this assessment criteria to make the conversation real, okay, to make you to feel like a real patient and healthcare professional consultation. I just love this kind of criteria. Now, this is time to move towards FAE formula, and I'm super excited to explain it to you. Let's have a look on this PPT. Now, FAE, first of all, let's see what FAE means. Now, F stands for find, A stands for ask more, and E stands for explore. Let's see. Find. Whenever you open the role play card, okay, and when you start reading, when you are getting connected with the patient, or even if you think about the real conversations, when the patient come in, first of all, you want to know why the patient is here, right? So the role play card also demands the same. The most of the role play card demands you to ask the patient that why they are here. Okay, so find opens the door. A, ask more. We want to build the whole picture. We want to understand the problem in detail. So we are asking more about the patient's symptoms, maybe patient's history, patient's background information. So we are asking more questions. And when we want to learn something specific in detail, then we try to explore. Okay, so that is going deeper into that conversation. So we want to investigate a specific thing. Okay, might be a feeling of the patient, might be behavior of the patient, might be reason for something to happen. Okay, let's have a look more in detail. So the first thing is find. Most of the OET tasks begin like find out reason for client's visit. And we have already seen this in the last video by opening the interview, how you can smoothly move towards this question. Okay, so the question you can form for this is, how may I help you today? How may I assist you today? Okay, then the second possible task, like when you're speaking to the carer, probably you want to find out the reason for request to see you. And in this case, you may ask, could you please tell me what's been bothering you? Could you please tell me what's been bothering you? Okay, see the intonation and try to practice that. Okay, you may pause the video, repeat after me. Okay, that is called mimicking. Okay, repeat after me and make it very natural. Okay, the third OET possible task is confirm the reason for the patient's visit. So we just want to make sure that patient is here for so and so reason. Is that right or wrong? So we may ask something like this. Hello, Mrs. Smith. I understand you are here because of your back pain. Is that right? So this is one of the possibilities. Okay, practice this. Hello, Mrs. Smith. I understand you are here because of whatever the reason is given in your role play card. And then you are asking, is that right? Or you may ask an open ended question. Hello, Mrs. Smith. Nice to meet you. What is your understanding about today's appointment? Okay, so these are the ways to ask these specific questions to the patients. Now, in this video, whatever questions I'll be forming will be one of the ways to ask a specific question, okay, or to cover this specific task. There are plenty of ways, okay, but if you want a specific way, you can practice this. All right. So another thing, like when the patient is for the follow-up consultation, okay, when you have already made one appointment with the patient, then the OET task says, find out how the patient has been since last visit, since last stroke, since, okay, always the task says something like that, okay. So how can you form a statement? How have you been since your last appointment? How have you been since the last appointment? How have you been since you were diagnosed with stroke in the last appointment, in the last visit? Okay. Find out how patient has been managing with exercise program. Now you think that you're a physiotherapist and patient came to you earlier, you advised some physiotherapy exercises, and this is a follow-up appointment where you want to make sure that how the patient has been managing since the last visit, okay, till now. So what question you can ask? How have you been managing with the prescribed exercises? How have you been managing with the prescribed exercises? Pause the video and repeat behind me. It would work. This is all about find. And as I said, find opens the door. Now we want to build the whole picture. A stands for ask more. Okay. So specifically, and this is most commonly asked questions in all 12 healthcare professions. So now pay attention. OET task says find out more about the problem. So why I have taken here as the problem? Because problem can be any based on your profession, right? But the most commonly asked questions are here, the bracket information, site, onset, severity, duration, frequency, triggers, relieving factors, any medications tried. Okay, so these are the questions they repeatedly ask. And how to approach this task? First of all, you should ask an open-ended question. Okay, let the patient tell you the whole story. Okay, and as we have seen in the assessment criteria, you need to ask an open-ended question and then appropriately move to the closed-ended question. So for this kind of task, you may ask that, could you please tell me a bit more about your symptoms? Or whatever the problem is. Okay, could you please tell me a bit more about something? Okay, and then you listen carefully. From the bracket information, what all things are covered by the patient? Okay, so patient might tell you that, well, I'm having severe headache. It's basically on my left side and it's very painful. Okay, so now you understood that patient has tell you the side of the headache. Okay, very severe, so very painful. So somewhat we have understood about the patient's severity. Okay, but rest of the things are still remaining. So what we will do that we will show empathy first. Okay, for the pain patient has shown, and then we will ask the remaining questions one by one. Okay, but nowadays the interlocutors are actually not giving any information. Rather, they may counter question you. Like when you ask that, could you please tell me a bit more about your problem? Okay. And the interlocutor asks you in response, what would you like to know specifically about my problem? And generally, what the candidates do, they'll say that, okay, tell me about your site or how severe your pain is, what has triggered the issues. Now, these are compound questions. When you ask more than one information at a time, you will start losing your score right from the beginning. And we don't want to do that. Okay, rather you may ask that, okay, I'll ask you certain questions. Would you mind answering now? Okay. And then you may ask the questions one by one. Okay, as you can see here, sorry. First of all, the site. Okay. Okay, could you please tell me where exactly the problem is? And when the patient responds, you write down on your card or on the piece of paper you will be provided. Okay, suppose patient says on left side, write down left. Okay, all right. When did it first start? You're asking for onset. Write down the answer over there. Okay, I'll tell you why you are writing the answers on the role play card. Okay. The third question is on the scale of 0 to 10, where 0 is no pain and 10 is the worst you can imagine. How would you rate it? Okay. Then duration. How long does it last? Now, see, when you ask the onset, you also get the answer of duration if the patient says that I experienced it 2 days ago. So you understood that the problem has been existing for 2 days. Okay. But sometimes we want to ask that for how long a specific episode lasts. Okay. So here we are asking a question, how long does it last? When it occur? Okay. Fine. The next question is about frequency. And you may ask, how often does it occur? Repeat behind me. How often does it occur? Fantastic. Let's see triggers. Does anything seem to bring it on or make it worse? Does anything seem to bring it on or make it worse? And you are writing down the answers, whatever the patient gives. Then relieving factors. Is there anything that seems to help or relieve it? Then medication tried. Have you taken or tried any medication for it? You may use any one of this, okay? Have you taken any medication for this? Or have you tried any medication for this? Okay, but make sure that you begin it with an open-ended question first. Okay, could you please tell me a bit more about your headaches? Okay, and listen carefully. Use active listening technique and show empathetic listening as well. Okay. Oh, I see. Something like that. Okay, but do not interrupt. And pay attention what patient says. Write it down because you are going to summarize this information. Okay, once you finish gathering the information. Now here, I have explained all the questions. What you should do, you should also convert these questions for third person singular because you don't always speak to the patient. You may speak to the relative or carer as well. And this is your assignment. You have to make questions for all this information for the third person singular. Okay, believe that you are speaking to the carer. Okay, how will you ask all these questions and comment below so that I can check your answers and I can give you correct answers as well. Okay, fine. Now we have covered find out, ask more. So now the third letter is E and that is explore. So whenever we want to explore more, we deep dive, okay, on a specific point. Let's see here. And as I said in Ask More, okay, when the interlocutor counter questions that what specifically you want to know about my problem, you are prompted to make a compound question by asking more than one information. But now you have studied FAE formula, and I'm pretty sure that you are not going to make this error. Similarly, in the explore point, you are prompted to ask leading questions. So try to avoid that. Let's learn how. So the point says that explore specific concerns about mother's recovery. So here we want to explore that what specifically is bothering the carer about mother's recovery. Okay. So ask an open-ended question that what specifically is bothering you regarding your mother's recovery? Okay. Do not ask that, are you concerned about your mother's mobility, falls, or independence? No, never ask this question. Okay. Create an open-ended question. What particularly is bothering you regarding your mother's recovery? Now, patient might respond you that my mother has been in the hospital for about couple of weeks after her surgery, and now she's very weak. I'm really concerned that she won't be able to do her household chores as she lives alone and she is at a risk of fall. I really don't want her to fall. But the carer has not covered about independence fully. Okay, so what you can do in that case, okay, you can completely understand your concerns regarding your mother's mobility and fall risk. Apart from that, do you have any other concerns? Okay, but don't ask that. Are you also concerned about her independence? No, it is a leading question. You thought that the carer is concerned about independence, and so you are asking. No, you'll lose score here. Okay. So, yes, you should ask an open-ended question for any task that begins with explore. Okay, like here, explore reasons for patient's anxiety. Okay, what specifically is bothering you? Okay, don't ask that, are you concerned about injecting process or do you have a fear of pain or needles? No, keep it as an open-ended question. Okay. So if something is left over, you may simply ask that, apart from that, is there anything else bothering you? Okay, so protect yourself from a leading question. So, just to summarize everything, FAE formula, and I know you know this formula, and I promise that if you are practicing all these questions, you will begin your interview and proceed it up to information gathering very, very confidently. Okay, F stands for find out the reason for patient's visit. Okay, it opens the door to understand why your patient is with you. Okay, A is ask more. Here we are building the picture. We are trying to understand what exactly the problem is, how it occurred, and what is the situation right now. And explore, we are going deeper into a specific point. We are trying to learn more about the problem, right? So that is FAE formula. And once you gather all the information, you need to repeat or paraphrase the information. Why? Because when you are repeating the information, you are making sure that you have understood your patient perfectly, correctly, and then you can make a right diagnosis, then you can make a right decisions, right? So you need to understand your patient, and so you are paraphrasing. Okay, you say, and you wrote everything on the cue card, on the role play card. That will help you to summarize the information. You will not need to memorize everything. Okay, you can simply read and paraphrase. Okay, so Kirti, you say that you are having headache on your left side. It is 6 out of 10, means you are in a moderate pain. Although you took paracetamol, it didn't work, and so you are here for the further examination. Is that right? Now, what happens? You are converting everything in your own words. Naturally, your sentence formation changes, you know. So, when you repeat the information as a candidate, you may feel that like, what is this? I'm just repeating what the patient said. But you are showing empathy, you are showing that you are an active listener, you are changing your sentence formation, so it increases your score on several assessment criteria. So don't forget to do this. Okay, the right place in your conversation to repeat or summarize the information, to show empathy, is during information gathering part. Okay, and summarizing at the end of information gathering before you start providing the information. And information gathering bullet points are maximum 2 to 3, okay, on your role play card. And you have to check when you are preparing for the interview. During your preparation time, you should be aware that, okay, this is the area where I will paraphrase the information before I provide the information. I hope you are clear with FAE formula, and I'm sure it would work for you. I will recommend you to practice all the questions and practice with someone else. Take your speaking partner. And if you can't find the right speaking partner, you can see the number is shown on the screen. You can join my WhatsApp group and you can communicate with each other and find the right partner for your speaking practice. Don't worry, I will provide you a PDF in which the detailed information is provided about all the questions, and the questions in a form when you are asking these questions to the patient directly as well as to the carer. So you can take a printout or you can just open it electronically and practice while you are, even while you are traveling. Okay, if you are using public transport, and make use of that time, practice with your and speaking partners. But know your test, practice it, practice it smartly, and don't practice it just by reading or just by understanding, because to produce it through mouth is a process. Okay, so practice it by speaking it loudly again and again until it becomes natural for you, but don't sound robotic during the conversation. Okay, it should sound natural. You are not AI, you are real humans, okay? So, and you are dealing with humans, so you should be very natural. So practice more. Nothing can stop you from getting the desired score, okay? See you in the next video for information providing. Okay, till then, bye bye.